Inflammatory bowel disease describes a group of conditions in which the two main forms are Crohn's disease and ulcerative colitis. These diseases inflame the lining of the gastrointestinal or GI tract and disrupt the body's ability to digest food, absorb nutrition, and eliminate waste in a healthy manner. Crohn's disease cannot be cured, and medications such as steroids and immunosuppressants are used to slow the progression of the disease. If the medicines aren't effective, a patient may require surgery. Welcome back to another episode of Polymer Club's Ask Dr. Paul. Today we're going to highlight the process of extrusion with thermoplastics. So when your boss talks about extrusion processing, what do you need to know? Let's discuss the figure on your screen going left to right. Thermoplastic pellets are placed in the hopper and a screw moves the pellets through a heated barrel similar to injection molding. The difference is the heated pellets flow through a die as shown in the figure instead of being injected into a mold cavity. With extrusion, it is common to make tubes, rods, and profiles, and the extrudate is cooled with air or a water bath and collected as a finished product. We all know humans have their own extrusion process, which we affectionately call a bowel movement. To ensure dimensions for thermoplastic extrusions, we have to understand amorphous and crystalline materials shrink rates, and a puller is also used to dial in the product dimensions. Wall thickness, ID, and tube OD are usually important. Besides finished product, extrusion is used to compound thermoplastic, where fillers, plasticizers, colorants, and stabilizers are mixed together to create pellets for molding. The extrusion process is also used to produce coextrusions, and I worked on a very interesting 5-layer tubing project back in the day. The goal was to route polar solvents through a meter-length tube that had to flex. The inner tube layer was HDPE since it is nonpolar and inert in the presence of polar solvents, and the middle tube layer was EVOH since it is flexible and provides a good or low oxygen transmission rate. We had to keep oxygen out of the system. The outer layer was LLDPE, and functionalized tie layers helped with the attach of the incompatible polyolefin and EVOH tube layers. A 5-layer tube means 5 extruders send material into a complex die to create the finished product. The tie layers were very thin, so we colored one blue and the other yellow, and we knew we had a good tube as long as it was green. You can imagine the challenge when extruding 5-layer tubing and keeping tube layer thicknesses constant. Consistent polymer flow at processing temperature is the key to having long runs with dialed-in tubing layer dimensions and without having loss of thin tie layers. Knowing the basics of thermoplastic extrusion and when best to use this process to make tubes, rods, and profiles, that's working knowledge. Remember to like, subscribe, turn on notification, and even share if you appreciate the content. You can visit our website to learn more about our upcoming Polymer Applications course. I'm Paul Nash for Polymer Club's Ask Dr. Paul. Thanks for watching.